great to be here, and I'm happy to introduce you to MDbackline. How often have you been to a doctor's visit and left only to say, gosh, I forgot to ask a question? Or, gee, is this symptom I'm having normal? Or have you said to yourself, wow, what a great doctor, what a great experience I had? And how often do we as doctors wish that we had more time to follow up with patients, to call them, see how they're doing, to educate them properly about what to expect, and to know how different treatments that we have compare to each other in an objective, patient-centered way? And how often does the drug and device industry wonder how its products are perceived and how they can best be positioned for patients and how to improve them for future generations? Well, MDbackline is designed to meet all these unmet needs. It's a patented, cloud-based, secure online system that automates contact with patients either before or after office visits, to ask how they're doing with treatment, to give them very customized patient coaching for the problem they have, and to let them ask questions of the doctor, as well as to give us doctors real outcomes data on our patients and to collect data for both meaningful use for CMS and for industry-sponsored research. And last, to solicit online reviews from the happiest patients. To build a solution, we worked with a team of actively engaged advisors who are strategy and finance focused, medical, legal and regulatory folks, and a technology team. We've built a solution that works like this. A doctor and a patient come up with a treatment plan, and then in just a couple of clicks within the EHR system that the doctor is already using, the doctor triggers the MDbackline on the cloud, which contacts the patient with email or SMS, and it has customizable delays and reminders. The patient can then respond by phone or tablet or computer to very simple questions that find out how they're doing and what they're doing. And then, in real time, give feedback to the patient that's both prioritized and categorized for them based on the answers that they've given the doctor's system, the MDbackline system. The doctor then gets a report through his team that filters whether the patient's doing very well or doing very badly or somewhere in between, so that the staff can prioritize its time and spend it only where it's most needed. So we currently have 4 modules in eye care, and we have a bunch more that are in development to be deployed. We've had to test the market as well, and we've learned that patients 60% of the time will respond to a module that's sent to them by their doctor. We've collected 5,000 responses now through our 4 partner sites, practices around the country that are leading sites in ophthalmology whose names and doctors you probably know. We've also had to deliver value to them, and we've learned that first, a patient who's better informed has a better outcome, and we get all kinds of positive feedback from patients who see this as an extra touch point with their doctor, an opportunity to connect. Doctors love the fact that we deliver their educational material, and they get 30% fewer calls, and over 90% of patients' questions are answered proactively and in an automated way by the system. We have airtight documentation of education. What we have told each patient is well documented and acknowledged by the patients. There's extra reimbursement opportunity for doctors by conducting research for industry, as well as meeting CMS meaningful use requirements. And doctors can document that with better quality care that we give them, they deserve better reimbursement. And last, and maybe best, doctors like that their happiest patients, which is most of their patients, are directed straight to the data entry box of the most popular social media sites. In the industry, we've had to deliver value as well, and our drug and device industry partners love that we can give them insights on and off-label uses of their products. We can help them with FDA trials, both post-market and registration studies, and we can give them in competitive intelligence they can't get anyplace else on who's using their products and why, and what do they really think about them. We've had to generate revenue if we want to be successful, and through our industry partners, which are the leading companies in healthcare, plus practices who pay us for our services, we've generated over $900,000 in revenue in the past 2 years, and this has supported all our company's costs. We've had no investors to date. We project that this revenue will grow to $5 million, $29 million, and $72 million over the next 3 years if adequate resources are in place to grow. So we've addressed an unmet need. We've built a solution that works, we've tested the market, and delivered value to all our stakeholders. We've generated revenue along the way, and so we're calling that a proven concept. And our next step naturally would be to expand across different disease states and EHR platforms, as well as into other specialties outside of ophthalmology. That's our goal. Currently, we're seeking investment partners, and we're in discussions with various venture and angel groups, as well as strategic investors, EHR companies, CROs, and even managed care plans. If you'd like to learn more about MDbackline, I encourage you to contact me with my contact information that's on the screen. Thanks very much.